Hello everyone, once again welcome to my Oet channel. Today we will see one exam question paper for speaking and the candidate cue card. It is for removal of earwax. So the setting is local clinic and a nurse role is you see a parent of a 4-year-old girl requesting strategies to remove earwax at home. You discuss the potential risk of attempting earwax removal at home and request the parent to consider bringing the child to the clinic instead. The child is not present. So if there is a hint that the child is not present, actually no need to ask a baby's name if it is not mandatory. So we will go to the task. The first task is find out the reason for the patient's parents visit. Actually, this is an unknown scenario and you don't have the baby with you. So you can start as usual. Good morning. My name is Rishmi Rajan. I am one of the staff nurse working in this local clinic. How may I assist you and how can I help you today? Or how may I address you and how can I help you today? So whatever way you can just introduce and you can just get the information. The answer will be good morning, sister. My name is John. Actually, I came here to get some information regarding earwax removal at home. It's for my baby. So, suggest to bring the daughter to the clinic. So, we are giving explanation. Then we can tell that, well, Mr. John, thank you for telling you the reason for your visit, but I'm really sorry to tell you that it is always advisable to bring your daughter to the clinic for proper examination than for earwax removal. So the reason behind of this suggestion, because your baby is small, I hope, could you please tell me her age? So the answer will be 4 years. Then you can tell that in this small age, actually John, it is very risky to remove the earwax at home. And the next statement is that explain the complication of earwax removal at home. They have given some examples: push wax deeper into ear canal, injury or irritation, as well as encourage the parent to bring the daughter to the clinic because they have given a reason: trained professionals, specialized tools and technique. So here we have to give the reassurance plus the exact reason of our request him to get the baby to the hospital. So we can tell like this: whenever you will explain some complication or something like negative things, you have to tell to the parent or the patient, I'm really sorry, so please try to use that sentence or please use that phrases and all. So you can tell like this: Mr. John, I'm really sorry to tell you that there are some complications of earwax removal at home, like you may push the wax deeper into her ear canal and it can lead to some injury because all parts inside the ear are very delicate and very soft, and easily it can get irritation and injury. Are you getting my point? You can tell that, therefore I'm strongly suggesting you to bring her to the clinic as I informed you, because I'm reassuring you that we have trained professionals and specialized tools and techniques in our hospital, so there will not be any possibility to get any irritation or injury to your baby's ear canal. How does it sound? Or are you getting my point? Or is it clear? Like that you can ask the question. And the next one is explain the importance of earwax. And they have given that it's natural mechanism to protect the ears, prevent the entry of foreign particles, antimicrobial properties, etc. And the subtask is stress the need for examination before earwax removal, like compromise natural protection, safest outcome for ear health, etc. How we can explain? So always see the task what you are going to do. It is explain the importance of earwax. Either you can ask like this: do you have any concern? Then the parent's question may be, so why you are over concerned about the earwax? It's just a earwax. So always we used to remove it with the earbuds. So maybe that is a quite natural question from the parent side. We can tell like this: I can truly understand your concern, Mr. John, but I have to tell you the importance of earwax because it is a natural mechanism to protect the ears, because the wax, if it is present in a minimal amount, it will prevent the entry of any foreign particles, any antimicrobial properties. So it will give a natural protection for your baby's ear canals and inside organs of ear. And I would like to tell you that It is essential for your baby to have examination before earwax removal, because if it is removed completely, sometimes it can compromise the natural protection, and sometimes it can lead to further infection later on. And we have to see the ear health of your baby. So are you getting my point? Like that you can ask them. Then the next task is reassure. So whenever you will talk to a parent, of course you have to give importance for the reassurance. It should be in the end always, but should be in the starting even. Reassure parent about treatment at the clinic, like specialist in ear care, safe and comfortable experience, etc. And outline what to expect at the clinic, like examination to determine the best course of action, process tailored for his or her daughter, and find out any other concern. So their reassurance, we can give that. We can tell that, Mr. John, I would like to explain you the treatment what we are going to do in this clinic. Usually we have specialists in ear care, and it is a safe and comfortable experience for your baby. And what you can expect at the clinic, once if you get your daughter to the clinic, the specialist will examine her ear to determine the best course of action. So through which route or through which technique they can remove the earwax without any complication or injury, as well as they will look for the possible protection, if there is any compromise of your baby's natural protection of ears, so they can give the best choice. And as I informed you, we have specialized person to handle baby's ear as well. So there is no need to worry about your baby's earwax. Even if you think that it is a quite normal process to remove the earwax, even with the birds, but please think about the age of your baby. Still, she is very small, and there is a great chance to get disturbances during the earwax removal. Maybe she may shake her head, even that causes the injury while you remove the wax. So I hope you can understand what I am explaining to you. Do you have any more concern, Mr. John? So like that you can ask them. And the answer will be, no sister, I got the information, it's okay, fine, and I will try to get my baby to the clinic. We can conclude like this. Well, Mr. John, I am very happy to know that you are agreed to get your baby to the clinic, and we are very happy to proceed with the procedure. And when you will come here, we will assign a specialist, your ear specialist for your baby, and we can remove the earwax very safely. And if you need any clarification, please do not hesitate to contact with us. This is our contact number. So like that we can conclude, or you can just tell that have a nice day and thank you for your visit. Even with that you can conclude the conversation. So the important thing it is that if you are talking to a parent, reassurance is important. More explanation is needed because they are more concerned about their babies, of course. So you have to give some more examples, and we have to give more details, like a positive reassurance from our side. So this is the most important thing other than the task. Even with the task, you have to take care of this reassurance as well. I hope this role play explanation is benefit for you, and please try to do with your friends always. Don't mug up with your things by yourself. Just talk with your friends, keep the time and practice well. And thank you for listening. We will see you with another one informative video. Until then, bye. Take care.